Here's something that most doctors will never tell you. Drinking more water during the day could actually be making your nighttime bathroom problem significantly worse. And the way you time your hydration may be doing more damage to your sleep than anything else in your daily routine. I'm Dr. Sonia, a practicing urologist with over 24 years of experience treating bladder dysfunction, nocura, and age-related urinary conditions. I've worked with thousands of patients, men and women, most of them over 60, who came to me exhausted, frustrated, and convinced they had a serious bladder disease. And the truth is, the majority of them simply didn't know how to drink water correctly. Now, in my previous video, I explained the 5 warning signs that your gut is leaking toxins into your bloodstream. And that video struck a nerve with so many of you. Today, we're going to go even deeper into something that affects your sleep, your heart, your kidneys, and your quality of life every single night. A landmark study published in 2019 by Nagasaki University in Japan, one of the most cited noctura intervention studies in recent years, found that targeted changes to fluid intake timing reduced nighttime urination episodes by an astonishing 40% in adults over the age of 65. 40%. No medication, no surgery, no expensive procedures, just a smarter relationship with water. Before we go further, I want to ask you something. How many times do you wake up at night to use the bathroom? Drop your number in the comments below. And if you're over 60, tell me that too. Your experience matters, and you might be surprised how many people are going through the exact same thing. Today, I'm going to walk you through the 3 most powerful hydration habits you need to know, ranked from foundational to genuinely life-altering. By the time we reach number 1, you will understand something about your own bladder and your own body that most people never figure out. And trust me, number 1 is not what you expect. In fact, it's the opposite of what you've been told your entire life. Don't skip ahead. Let's begin with number 3. And this one surprises almost every patient who walks into my clinic for the first time. Your kidneys are not passive filters. They are dynamic, rhythmic organs that actually change their behavior based on the time of day. During daylight hours, your kidneys are in full production mode, filtering your blood rapidly and producing urine at a high rate. But as evening falls and your body prepares for sleep, a hormone called vasopressin, also known as antidiuretic hormone, rises significantly in your bloodstream. Vasopressin signals the kidneys to slow down urine production, concentrate the urine that is being made, and give your bladder a chance to rest overnight. This is the body's natural design. The problem is, if you drink a large volume of fluid in the 2 or 3 hours before you go to bed, you overwhelm that vasopressin signal. Your kidneys keep producing urine even as you try to sleep, and your bladder fills up faster than your brain's sleep center can suppress the urge to void. A 2020 study from the University of Toronto, published in the Journal of Urology, examined 412 adults with documented nocturia and found that those who implemented a structured fluid cutoff 2 to 3 hours before bedtime reduced their average nighttime voids from 2.88 per night to just 1.6, a 43% improvement. A separate 2018 study from MRI University Medical Center in the Netherlands confirmed these findings, showing that evening fluid restriction led to a 38% reduction in nocturnal urine output volume in participants aged 60 and above. One of my own patients, Mahi, a 68-year-old retired schoolteacher from Ohio, came to me getting up 4 times a night. She was drinking herbal tea, water, and juice right up until she turned off the lights. After we implemented a simple 7:30 p.m. cutoff time based on her 10:30 p.m. bedtime, she was down to 1 nighttime void within 3 weeks. She told me she felt like she had her life back. Now, age plays a critical role here. After the age of 60, vasopressin secretion begins to decline measurably. Research from the University of Amsterdam, published in 2017, found that adults over 65 produce up to 30% less vasopressin at night compared to adults in their 30s and 40s. This means that even a modest amount of evening fluid, 2 or 3 glasses, can tip your bladder over its threshold when you're older, whereas that same amount would have been handled effortlessly in your younger years. This is not a disease, it is biology, but it is biology you can work with. To implement this starting tonight, simply identify your target bedtime and count back 2.5 hours. That is your last fluid intake moment. Set a gentle phone reminder if you need to. Your last beverage should be small, no more than 6 ounces, and it should not be caffeinated or alcoholic because both caffeine and alcohol interfere directly with vasopressin function and will amplify your nighttime output regardless of volume. This habit pairs powerfully with number 2 on our list because number 2 addresses what you drink, not just when you stop. And what you've been putting into your body before that cutoff window may be silently sabotaging everything. Coming up next, we talk about the hidden bladder irritants that most people consume every single day without realizing they are sending their bladder into overdrive. And one of them is probably sitting on your kitchen counter right now. Number 2 is where things start to get really interesting, because this is the habit that fundamentally rewires your entire relationship with water. Most people I see are not drinking too much water overall. In fact, many are dehydrated. The problem is the distribution. They drink very little in the morning, a moderate amount at lunch, and then they try to catch up in the afternoon and evening, flooding their system with fluid right when their kidneys need to be winding down. This pattern is physiologically backwards, and it is one of the primary drivers of nocura in otherwise healthy adults. Here is the mechanism your body uses. Your kidneys process fluid most efficiently during the active, upright, and physiologically alert hours of the day, roughly 7 a.m. to 2 p.m. During this window, your body's sodium regulation, aldosterone levels, and renal blood flow are all optimized for high-volume processing. If you consume the bulk of your daily fluid, which for most adults should be somewhere between 1.5 and 2.5 liters, during this morning and early afternoon window, your kidneys clear it efficiently. Your bladder fills and empties normally through the day, and by evening your body has already done the hard work. What remains in your bladder at bedtime is genuinely minimal. A 2021 clinical trial from Seoul National University Hospital published in Neurology and Urodynamics divided 320 nocuria patients into two groups. A control group that drank water without timing guidance and an intervention group that consumed 70% of their daily fluid before 2 p.m. After 8 weeks, the intervention group reported a 47% reduction in nocturnal voids, while the control group saw only a 9% improvement. A 2019 study from Keio University School of Medicine in Tokyo showed that front-loaded hydration also reduced mean nocturnal urine volume by 35% in men aged 55 to 75. I want to tell you about Robert, a 71-year-old retired engineer who came to me after 2 years of waking up 3 to 4 times every night. He was convinced he had prostate trouble. And while we did address some mild prostate enlargement, the real revelation came when we tracked his drinking habits with a 48-hour fluid diary. He was drinking fewer than 400 milliliters before noon, and then consuming almost a liter between 6 o'clock and 9 o'clock p.m. We flipped his schedule. Large glass of water first thing in the morning, consistent hydration through the day, firm stop at 7 p.m. Within 6 weeks, Robert was averaging 1 nighttime void, down from 3.5. His sleep score on his smartwatch improved by 28 points. For those of you over 65, this front-loading strategy becomes even more essential. As we age, our thirst sensation weakens. A well-documented phenomenon confirmed in a 1992 study from the University of California, San Francisco that has been replicated numerous times since. This means older adults frequently underdrink in the morning because they don't feel thirsty, then overcompensate late in the day when habits or routine triggers them to drink. Breaking this cycle is one of the most powerful things you can do for your sleep. Here is how to start immediately. Tomorrow morning, before you have coffee, before you check your phone, drink a full 8-ounce glass of water, then aim to drink another 2 glasses before noon. Set a phone alarm at 11 a.m. If you need a nudge after lunch, taper off gradually. By 5 p.m., and shift to sipping only. This does not cost you anything. It does not require a prescription. And when you combine it with the cutoff window from number 3, you create a synergistic effect. Your kidneys get the volume they need early, and then they get the signal to rest that they need at night. But here is what almost no one talks about, and what I consider the most important discovery in nocura management in the last decade. Number 1 is not about when you drink, or even how much you drink. It's about something happening in your body while you sleep that you have almost certainly never thought about. And here we are. Number 1, I want you to lean in for this, because in my 24 years of practice, this is the single concept that has transformed outcomes for more patients than anything else I have ever implemented. And when I first explain it to patients, almost every single one of them looks at me the same way with complete and utter surprise. The concept is this. For many adults, particularly those over 60, nighttime urination is not primarily a bladder problem. It is a fluid redistribution problem. Here is what happens. Throughout the day, if you consume a moderate to high sodium diet, which the average American absolutely does, taking in nearly 3,400 milligrams daily, according to the CDC, fluid accumulates in the tissues of your lower body, particularly in your legs and ankles. This is called peripheral edema, and it may be subtle enough that you don't even notice it. But when you lie down flat at night, gravity no longer holds that fluid in your legs. It redistributes upward, re-enters your circulation, travels to your kidneys, and is filtered directly into your bladder. This is why so many people feel perfectly fine going to bed and then find themselves urgently needing the bathroom within 60 to 90 minutes of falling asleep. A remarkable 2017 study published in the Journal of Urology by researchers at Nagasaki University, one of the most talked about nocturia papers in recent years, enrolled 321 participants and had them reduce their daily salt intake from an average of 10.7 grams to 8 grams. Just that modest reduction produced a 25% decrease in nighttime voids, with participants going from an average of 2.3 nightly bathroom trips to 1.7. A follow-up study from the same institution published in 2020 showed that combining salt reduction with afternoon leg elevation produced a combined 52% reduction in nocturnal urinary volume. A staggering outcome for such a simple zero-cost intervention. This is where the synergy with our earlier two habits becomes explosive. When you front-load your hydration before 2 p.m., you minimize afternoon fluid intake. When you reduce your sodium, you reduce the amount of fluid your tissues retain during the day. And when you combine both with a firm evening cutoff, you send your kidneys into the night with very little work left to do. These three strategies compound on each other in ways that no single intervention can match. Let me tell you about Dorothy, a 76-year-old woman who had been waking up 4 to 5 times every night for over 3 years. She had tried 2 different medications. She had done pelvic floor therapy, and nothing had given her sustained relief. When she came to me, I ordered a simple 24-hour urine collection and a dietary recall. Her sodium intake was over 4,000 milligrams per day, well above recommended levels. And her nighttime urine output was 68% of her total daily urine volume. That is a textbook sign of nocturnal polyuria driven by fluid redistribution. We implemented a sodium reduction to under 2,300 milligrams, added an afternoon rest period with her legs elevated for 30 to 45 minutes, and combined that with the hydration strategies we've already discussed. Within 8 weeks, Dorothy's nighttime voids dropped to 1 to 2 per night. Her total nocturnal urine output fell by 44%. She wept during our follow-up appointment. After 60, this mechanism becomes dramatically more pronounced for 2 reasons. First, the venous walls in the legs become less elastic, making it easier for fluid to pull in soft tissue. Second, the heart's pumping efficiency often decreases slightly with age, meaning less fluid is returned from the legs during daytime activity. Research from Johns Hopkins University published in 2016 confirmed that adults over 65 with even mild cardiovascular aging show significantly higher rates of nocturnal polyuria related to this positional fluid shift compared to younger adults. Here's your action plan starting today. First, spend 1 week honestly tracking your salt intake. Read labels. The biggest hidden sources are bread, canned soups, deli meats, and restaurant meals. Aim to get below 2,300 milligrams per day. And if you can reach 1,500, even better. Second, if you tend to sit for long periods in the afternoon at a desk, watching television, or reading, elevate your legs for 30 to 45 minutes before dinner. A pillow under your calves works perfectly. This simple position shift allows your circulatory system to return that pulled fluid to your bloodstream and kidneys while you are still awake and upright. So your bladder handles it before bedtime instead of at 2 a.m. Third, and this ties everything together, combine this with your morning hydration habit and your evening cutoff. This trio of strategies works as one unified system, and the results for patients who implement all 3 consistently are truly remarkable. Now let's bring it all together. Let's bring this home. Number 3, establish your fluid cutoff 2 to 3 hours before bed because your kidneys need that time to wind down alongside the rest of your body. And if you're over 60, your vasopressin system needs that buffer even more urgently than it did when you were younger. Number 2, front-load your hydration. Drink the majority of your water before 2 p.m. When your kidneys are physiologically primed to process it efficiently and your bladder can do its job during normal waking hours. And number 1, the one that changes everything. Reduce your sodium and elevate your legs in the afternoon to stop that silent, invisible flood of fluid that migrates from your legs to your bladder the moment you lie down at night. Here is what I want you to hear most clearly. Improving your sleep, your bladder health, and your nighttime comfort is absolutely possible at any age. These are not cures reserved for the young. They are biology-backed strategies that work precisely because they work with your aging body, not against it. Now, I want to know which of these three will you start first? And what is your biggest challenge when it comes to waking up at night? Tell me in the comments. I read every single one, and your question might become the subject of my next video. If this helped you, please hit the like button right now. It tells YouTube that this information is reaching the people who need it most. Subscribe so you don't miss what's coming next. Share this with someone you love who is losing sleep. And leave your thoughts below. Your body is not broken. It is simply waiting for the right information. And now you have